Representative Scavello.
Thank you, Mr. Chairman, and thank me for allowing me to sit in on this hearing. In the past 10 years, I must have done about 100 or so legislative shows, and I did one on Lyme disease, and I had more calls in my office on that one show than any other show that I've ever done. It's out there, and it's scary. My question, a question that I'm going to submit is, if we know that the test doesn't work, why aren't we looking for a test that will work, or somehow or other? Because I think the early detection is so important, and it's something that I hope that we can look at with this legislation. Chairman.
Anybody else? Well, I'm going to recognize, I guess, Representative Hess, the prime sponsor of the bill. And again, we really appreciate you bringing this bill to the attention of the committee. I'm going to ask you if you have any final comments.
Thank you, Mr. Chairman. At this point, I'll try to be as brief as possible. I know we're running over. But I want to thank Gene for you bringing this bill forward, because it's something very near and dear to my heart. Some of the things that we have discussed here today, I'm not going to reiterate again, but I may be submitting some questions to some of the testifiers, especially Dr. Smith's testimony. I really enjoyed what he had to say, and I will be communicating with you in a further concerning it. But on a personal basis, I just wanted to mention some of the things that was talked about here today. I have two people in my family that have Lyme disease. I have a daughter-in-law that is very, very bad. Some of the things that was mentioned here today, I've experienced, I've seen, went through. Misdiagnosed by approximately 3 or 4 different doctors. I'm not picking on them. This is why the education is so important. All kinds of things were mentioned, nerves, stress, MS, you can go on and on. It went over a period of at least 10 months until, ironically, a technician at one of the area hospitals said to her, Liz, I think you have Lyme disease. And through the discussion, she was directed to a doctor in the Philadelphia area, which we were very thankful for. Through his treatment, we have her back. Some of the things that she went through, the symptoms you mentioned here today. But without his treatment of the antibiotics and so forth, she would be a pillar of salt. And I've seen her in that condition as a pillar of salt, literally freeze up for half hour at a time, in the middle of taking a bite of food, not being able to walk without guidance, sleeping for 8 to 10 hours after she has one of these seizures. And speaking with her yesterday, she seen what was happening, knew what was happening around her, but she couldn't communicate. She could hear you talking to her. And without this particular doctor, who I'm not mentioning his name, without his help, she wouldn't be here today. And also my son had Lyme disease, but not the severity that she had. And she's still suffering with it today. She needs the long-term help. If the long-term antibiotics is being opposed by the medical society, tell us what's better. Tell us what's better. We need to help these people now. With the best, this is the best we have. So we use the best we have. And that's what we're doing. So don't chastise those people that are helping us. Give them help. And that's what we're going to try to do with this bill. If there's certain things in the bill at this point that we might need to tweak a little bit, Mr. O'Neill, we talked about this yesterday, and I'm willing to do that. But I'm committed to get this bill through. With Gene's help and some other people's help, we're going to get it done.
Okay, Dick, thank you. And again, I want to thank everybody that's here today. the passion you have for the issue is very, very obvious, and Lisa